Have you ever started a new medication hoping for relief, but ended up feeling heavier, foggier, or just not yourself? That's exactly how a lot of patients I work with describe starting traditional, older antipsychotics or other mood stabilizers. I'm Dr. David Danish, a double board certified psychiatrist, and today I'm talking about Caplyta, otherwise known as Lumateperone, a newer atypical antipsychotic medication that's turning heads for its balance between effectiveness and tolerability for both psychotic disorders and certain types of bipolar depression and soon unipolar depression. It is currently FDA approved for schizophrenia and bipolar depression, and it's already changing how we treat complex mood disorders. Additionally, the word on the street is that it will soon be FDA approved for add-on treatment for regular or unipolar depression rather than just for bipolar depression. So stay tuned. I'll walk you through what it does, who it helps, and what to watch out for. Caplyta is an atypical antipsychotic mood stabilizer used to treat specific psychiatric conditions. Again, FDA approved for schizophrenia as well as bipolar depression, and soon for add-on treatment for depression itself. It also can help with depressive episodes associated with bipolar II disorder. Like all atypical antipsychotics, Caplyta affects dopamine, but Caplyta binds at a much lower percentage, around 40% at that dopamine receptor compared to other medications in its class. And that may explain why it tends to cause fewer movement issues or oversedation for many patients. It also works on serotonin and glutamate, which could both play a role in its antidepressant and mood stabilizing benefits. For bipolar depression, many patients report mood improvement within 1 to 2 weeks. For schizophrenia, psychotic disorders, benefits typically emerge between 4 to 6 weeks, though progress may be more gradual. In my practice, I tend to use Caplyta for bipolar depression, whether it's bipolar 1 or 2, and I've also used it in some cases of tough to treat unipolar depression with good outcomes. Again, it's not quite FDA approved for this, but it's looking like maybe fall of this year that will change. Let me walk you through the top 3 side effects I see most often in my patients. Mild sedation or drowsiness usually resolves in the first week or 2 or the next week after increasing the dose. Taking it at night helps. Some GI issues like mild nausea, stomach upset, but these are often temporary. And then mild metabolic effects, most people stay weight neutral or even lose weight though, which is a big difference compared to other medications in its class that work on bipolar depression, such as Seroquel or Zyprexa. The very rare side effects to watch for. In one case, I did have a patient with significant restlessness, but this is extremely rare. And I had another case of a patient having what we call dystonic reactions or muscle stiffness. Now again, this is exceptionally rare. Remember, this medication does not protect against manic symptoms. So if you're bipolar 1 or 2 and you are taking Caplyta for bipolar depression, keep in mind you very well should be on another mood stabilizer of some kind to prevent those manic episodes. Anybody on an atypical antipsychotic that works on dopamine has to watch for a long-term risk of something called tardive dyskinesia. It is something that is exceptionally rare in the newer medications like Caplyta, but it still may occur. It's something that I have made a longer video about, and I'll be sure to put that link in the description. For a full, comprehensive list of every possible side effect, including various dosing and various strategies to help with those side effects, please visit my Mind Vault at drdaviddanish.com for that free resource. And again, I'll put that link in the description for sure. Now, Caplyta is newer, therefore it is expensive, and insurance coverage is not always smooth. Because it's so new, prior authorizations are often required. The good news is the manufacturer does offer copay assistance programs to help offset costs. Caplyta's effect on schizophrenia is modest compared to some other options, which are stronger, but also likely have more side effects. It does show benefit in clinical trials, but the degree of symptom improvement tends to be more limited than with some of the more established antipsychotics, such as, let's say, Zyprexa, Risperdal, Seroquel, etc. While early research is very promising, and it's likely going to be FDA approved soon for the add-on for unipolar depression, it is not my go-to choice as an add-on medication right now. I tend to try to avoid atypical antipsychotics as add-on treatment for treatment-resistant depression unless we've been through so many other options. There are so many other add-on medications that should be done first just because of the potential for the various side effects, including tardive dyskinesia, which I mentioned earlier. That said, it is a great medicine for some patients who failed a lot of other options, so I don't want to villainize it here. It just should not be reached for as a first thought to add on to a regular antidepressant before considering other options like either switching the first antidepressant to something else, adding on a Wellbutrin to an SSRI, trying Auvelity as an add-on to your regular antidepressant, trying ketamine, Spravato, transcranial magnetic stimulation. There are so many options out there that should be tried before adding on an antipsychotic such as Caplyta or such as Seroquel or Vraylar. Those ones that are great as an add-on, nonetheless, they come with side effects. Here's how I feel about it. Caplyta feels like a breath of fresh air in psychopharmacology. It tends to be best for my patients with bipolar depression, especially those with bipolar 1 or 2, and those with mixed features, or those who have metabolic concerns because of other medicines they're on. Folks with schizophrenia who've struggled with weight gain or movement side effects on other medications, and their schizophrenia is not as difficult to treat, Caplyta could be perfect for them. In rare cases of an add-on treatment for depression that has not responded to traditional antidepressants and many other options, then I will go to this. Now, those who we might proceed with caution are those who have a sensitivity to atypical antipsychotics, of course, those who are prone to movement disorders, or those who get easily sedated on medications. While this one is not nearly as sedating as, say, Seroquel, I have had patients complain of a little bit too much lethargy. On the other hand, I've had other patients say it helps them sleep a lot better. What should you expect early on while taking it in the first 1 to 3 weeks? You're looking at a functional shift, not just symptom relief, more clarity, less emotional heaviness, better stamina, a little bit more motivation, especially when switching from meds that cloud your energy or cognition. Caplyta is not just another atypical antipsychotic for which we have an ever-growing list. It's a new paradigm in how we approach mood and psychotic disorders. Its promise lies in delivering effectiveness without the typical burdens of weight gain, mass oversedation, or huge metabolic risk with high weight gain and developing diabetes. Again, if you want that full list of both on and off-label uses, all side effects, and all doses, please head to the Mind Vault. Also, if you're looking for a great free resource on research-backed ways to supercharge your antidepressant, whether that antidepressant is this or another for either unipolar or bipolar depression, make sure you look at that resource, and I'll put that in the notes. It is research-backed ways to amplify the chance that your antidepressant works while you start it. Please share this with anyone who's interested in Caplyta or considering a switch. It might just make a difference for them. I'll see you in the next video.